Hola, buenos dias. It is an absolute pleasure to be here today in Mexico City at the National Academy of Medicine. And I want to, first of all, say a huge thank you for the opportunity to speak here. It is an honor. And also with huge thanks to the National Institute of Public Health, to UNICEF, to World Obesity for organizing this event. I know how much effort goes into it. And it is a pleasure to be here in Mexico, and I just wanted to start by sharing some of my experiences over the last week or so in Mexico. I started my trip here paragliding, flying around the countryside and exploring some of the beautiful landscapes and the countryside of Brazil. Sorry, what am I saying? Mexico. Excuse me, jet lag. And also exploring some of the incredible food and the food culture and something about the traditional food system that Mexico has and the diversity of incredible food that you have here. And relating to that, this encroachment, this invasion, I think, as Mauro said, of ultra-processed foods, I like to use the term the coca colonization of Mexico by one company in particular, and to see these remarkable policy responses that Mexico has taken to counter ultra-processed foods. And I think the leadership that Mexico is showing in this area is truly remarkable. It is the best in the world, and Mexico has the best food policy researchers, advocates, and political champions taking on this industry, and I just wanted to say that and recognize it. And finally, I'd just like to recognize the wonderful people that have connected with here from the National Institute of Public Health, from Apertura, Coordinador, and others. It's been a really great learning experience. Before I talk about this topic, I wanted to acknowledge that there are many papers that inform this presentation today, and that includes the recent Lancet breastfeeding series that was published in February this year. 3 papers that really do a very deep dive into this marketing of commercial milk formula and into the political and economic drivers and the commercial drivers of the displacement of breastfeeding by commercial milk formulas. Internationally, there is a lot of attention to food systems, and we call this, our group at Deakin University calls this the Food Systems Transformation Agenda. Since 2016, there has been over 70 international reports by world-leading expert groups, by United Nations agencies, all of them calling for the transformation of food systems for health, for nutrition, for environmental sustainability. We have to transform food systems. The leading contributor to climate change, to poor nutrition, to poor health, huge social, economic, and cultural implications, and we have to do this for the future of our planet and for the future of our children. And a sustainable food system is one that ensures food security and nutrition in such a way that the economic, social, and environmental bases to generate food security and nutrition for future generations are not compromised. And in this definition, there is emphasis on for future generations. And that means the children of today and the children that are yet to come, the unborn generations. And that's really who we do this work for the child, for children, to protect the rights of the child. And yet, when we look at this food systems transformation agenda, children are not given anywhere near enough attention or focus. And so to reverse this, to give much more attention to mothers, families, children in this food systems transformation agenda, we coined this term, first food systems. as the food systems that provision foods for mothers, infants, and young children from conception to 36 months of age, and that structure feeding practices at the population level. And we use this framing, first food systems, very deliberately because it focuses attention not on the feeding practices of the individual mother, of the family, of the child, but to the system itself, to the societal context, to the political, economic and social drivers of feeding practices across entire populations. And so we use this framing and this framework to understand why breastfeeding rates have gone down in some countries, why they are going up in other countries, and why we're seeing this explosion in the consumption of ultra-processed foods in early life. It's because we're seeing these transformations in first food systems, and much of this is being driven by commercial drivers. I'd like to also just mention the vital contributions of breastfeeding women to healthy and sustainable food systems. And the mother-child breastfeeding diet is remarkable. It's a system of nurture, nourishment, and care responsive to the child's evolving needs. It's a safe form of nutrition. It's a sustainable form of nutrition, and it is a vital food source. It is essential to food security of the child. And the capability to breastfeed makes vital contributions to the advancement of women's and children's rights, the rights to health, the rights to food, and the right to life. And WHO recommends that infants initiate breastfeeding at birth, are breastfed for 6 months, and then continue to breastfeed alongside the introduction of nutritious complementary foods up to 2 years of age or even beyond. So it also emphasizes continued breastfeeding. And yet when we look at the statistics worldwide, the UNICEF statistics, we find that less than half of children are meeting these recommendations. The good news is that these statistics are improving, but still less than half of children are meeting these recommendations. At the same time, we have seen this remarkable rise in the consumption of commercial milk formulas. Children's diets, infants and young children's diets are becoming more ultra-processed. And commercial milk formulas are really the first ultra-processed food. Infant formula was invented in the 1860s to serve a really important social need. There is a need for infant formula. It is a really important food product for infants that cannot breastfeed, and there should be no stigma against using infant formula when it is necessary to do so. But infant formula is not used in that way today. It is marketed and consumed at levels that far exceed that background basic need. And it has been transformed into really a mass-produced consumer good. And as we know, it is much more now than infant formula. It is toddler milks, growing up milks, a whole range of ultra-processed food products that are being consumed unnecessarily. And this market for formula has grown remarkably. So in 1978, 3 years before the International Code of Marketing of Breast Milk Substitutes was adopted by the World Health Organization, this market was valued at $1.5 billion. Excuse me. In 2019, this market was US $55.6 billion, a 36-fold increase in the sales of formula since 1978. And in our early research, we sort of described this as truly remarkable, that is unprecedented in human history, that there has been never before a change in infant and young child diets that resembles anything like this transition to higher formula diets. And we know that this is harmful to maternal and child health. When it displaces breastfeeding, we know that it associates with increased risk of infection, obesity and other health outcomes, that it compromises food security, and we saw that in your neighboring country, the United States, recently with the milk formula crisis and the low levels of breastfeeding. That is a matter of food security, and it also has implications for the environment. the excessive production and consumption of these products contributes to greenhouse gas emissions, to plastic waste, to excessive water pollution. And so the World Health Assembly of the governing body of the World Health Organization adopted the International Code of Marketing of Breast Milk Substitutes in 1981. And this has been seen as, and arguably is, one of the most important successes in public health in the last 50 years. It resulted from the collective advocacy of civil society groups, of experts, of UN agencies and governments. And it was there, the code was established to stop the aggressive marketing and promotion of breast milk substitutes, of commercial milk formulas, that was causing so much harm and still is causing so much harm today. And yet, as of 2020, 70% of countries have adopted some provisions of the International Code of Marketing International Law, which is fantastic. Yet, only 13% of countries have adopted the provisions of the code completely or fully into national law. So there is still a long way to go to implementing the code into national laws by governments all around the world. And that's a very interesting sort of research question. 40 years after the code was adopted in 1981, why do we still have so far to go for countries to fully implement these provisions into national law? And so our research provides, I think, an explanation for this, which is the power of the commercial milk formula industry. And so working with the World Health Organization and receiving funding from the World Health Organization, we set out to answer a few questions to help think about how we can accelerate worldwide implementation of the code. First of all, we asked, well, who is big formula? We use the term big formula like we would say big tobacco. Who is the commercial milk formula industry? And we define the industry, and you would know these companies well, as at the core, the manufacturers, Nestle, Abbott, Danone, Mead Johnson, Friesland Campina. These are the dominant baby food companies in the world. But it is also the dairy industry and other industries that are codependent upon the profit from the manufacture and distribution and marketing of these products. And also, it's their lobby groups. It's not just the companies or their suppliers. It's also the the public relations agencies, the professional lobbyists, and the lawyers that work for them. And we asked, what strategies have the corporations, has this industry used to drive, to shape first food systems and drive the consumption of formula on a global scale? And how can we understand these strategies in terms of power? And power can be conceptualized in lots of different ways. And if you're interested in reading more about how we conceptualize this, corporate power, please feel welcome to read the third paper of the Lancet series on breastfeeding, where we introduce this political economy framework that explains some of these concepts. I won't go into the theoretical aspects of it now because it's too lengthy, but I do encourage you to read the paper if you're interested. Now, the first way of understanding the rise of commercial milk formulas, this explosion in consumption, is just simply to look at how the industry itself has globalized. And these corporations are from the United States and they're from Europe. That's where they originate. And over time, they have grown their markets in the United States and Europe, and eventually those markets have become saturated, and the companies have pursued new opportunities for growth in emerging markets in low and middle income countries around the world. And over time, companies like Nestle have established more and more factories in more and more countries manufacturing commercial milk formula. But we show in our research that this globalization of the industry has hugely accelerated only in the last 20 years. Here you can see the circles represent how much milk formula is produced in a country, and the arrows represent how much milk formula is traded or exported from one country to another. And you can see very clearly this huge explosion in the production and trade in commercial milk formula. And this is important to understand from the perspective of power, because when Nestle moves into a country, they establish factories, they start to employ people, they start to source their ingredients from local suppliers, local dairy companies and so on. And they use that politically. They say, well, we are providing investment, we are providing jobs, we are sourcing from your local ingredients from your local industries. Therefore, if you regulate us, you will harm our employees, it will cost jobs, it will cost your economy. And this is a very powerful argument they make time and time again. So as the industry has globalized, so too has its marketing. So with the companies go commercial milk formula marketing. And we describe, in the Lancet series, we do a very broad description of this marketing. But just to summarize the core strategies, the first is medical marketing to health professionals. And it's just like how Nestle uses George Clooney to sell coffee, or how Nike uses Michael Jordan to sell shoes. Formula manufacturers use health professionals to sell formula. They are the influencers, if you like, because they have a very strong influence over how parents feed their children. And so this has always been the industry's most important marketing strategy. It was invented by Nestle in the 1890s and has continued since then. The second strategy is direct-to-consumer advertising, and you've probably seen these advertisements everywhere. And now these advertisements appear much more powerfully on digital media, and the digital marketing of breast milk substitutes is something that's actually being addressed by the World Health Organization, who will release their guidelines on this very shortly. But it's a very powerful form of marketing and influence, and that includes using influencers, so-called mommy bloggers, direct advertising, targeted advertising, very precise individual level advertising to expecting mothers and to new mothers and families. And the third strategy are product strategies, and this involves putting claims on products, for example, and promoting them as safe, nutritionally adequate, healthy, adding specific ingredients, making claims like organic, promoting products as improving the intelligence of the child. These types of claims are made very, very frequently. And many of these claims, as was published recently in the British Medical Journal, are unfounded. They are not supported by rigorous scientific evidence. And underpinning all of these strategies is corporate science. So this is all of the companies have very large research infrastructure and researchers, large numbers of researchers who develop this corporate science, which helps to support their marketing. The other aspect of this is that, and this I think explains so much of why we've seen this explosion in formula, is that the companies have essentially broadened or widened the boundaries of the mother and child populations that they can market to by inventing new formula products. And before the 1980s, there was really only one or two products on the market, and they were for infant formula from birth onwards, or follow-up formula from 6 to 12 months in the 1950s or around 1947, and then some allergy formulas. But it wasn't until after the code was introduced in 1981 when governments started to regulate infant formula, that the companies really started to heavily market follow-up formulas and growing up milks for older infants or for young children. And this was a very powerful strategy to essentially market around the regulations that were focused on just infants. And today, these follow-up milks and growing up milks comprise more than 50% of the industry's sales. So it has been a very effective way for the industry to essentially grow its sales. I wanted to say a bit more about this medical marketing because I know there are many health professionals in the audience today. And one of the three most prominent examples that I've seen in our work about how the industry creates conflicts of interest in relation to health professionals is, first of all, directly funding health professional associations, sponsoring conferences, offering prizes for students, offering scholarships, and making direct payments to professional associations. This is a very, very powerful form of influence. And it silences health professional associations that do not speak out against formula companies because they are receiving money from formula companies. And this not only influences clinical decision making, it is also, I think, breaches ethics. I think it breaches the values that we should hold in upholding the rights of a child to the best possible nutrition and health. And I'd say we need to call on health professional associations to end these financial relationships with the formula industry. The second is the influence that the companies have over clinical guidelines. And we've seen this with specialized formulas. And this graph in the middle here is from the United Kingdom, where we've seen 10 times more diagnoses and prescriptions of specialized formulas for cow's milk protein allergy. So these are formulas for children with allergies than we would otherwise expect, given the background prevalence of the actual problem. So we call this industry-driven overdiagnosis. Children in the UK are being given specialized formulas 10 times more than they need that formula, which is kind of crazy, right? And when you look at the clinical guidelines, who's writing the clinical guidelines around the diagnosis of these of cow's milk protein allergy? 80% of the authors of those guidelines have a relationship with the formula industry. Some of the guidelines are actually written by the formula industry itself, by advertising executives. So this is truly a conflict of interest. The third is education, health professional education. And I don't know if people here in the room have been contacted by, if students here in the room have been contacted by formula companies, offering them to connect with them on WhatsApp, or offering them scholarships, or holding seminars for them, but that is very common. The other approach is by offering continuing education for health professionals, especially for pediatricians, for dietitians, for nutritionists, and for allergists. And this example here is from the Nestle website, these e-learning programs where they enroll many hundreds of thousands of health professionals into these Nestle-sponsored videos and training programs. Now, that I've really just talked about the marketing so far and the conflicts of interest that generates. Now I'd like to talk about the politics and the political influence of the industry, because as the industry has globalized, so has its political influence. And this network here shows the lobby groups of the industry that they have worldwide. So each of those small names is a lobby group. And you can see that the companies have different size circles, and that indicates the number of lobby groups that each company belongs to. So you can see that Nestle, as the most globalized and largest baby food company, belongs to, or as a member of, or finances the most lobby groups around the world. And so we can say, I think quite clearly, that these companies are coordinating this network of lobby groups in different countries around the world, and in relation to the World Health Organization and other UN agencies, to influence, to block the implementation of the International Code of Marketing of Breast Milk Substitutes. In red, you can see, in the red color there, these are the infant nutrition associations that lobby specifically in relation to the regulation of baby food and the marketing of baby food. And in Mexico, the lobby group is called CANALEC. Just like CANALEC, we see the same thing in lots of other countries. You also see some of the industry trade associations that represent ultra-processed food manufacturers, like ConMexico is the one that's most prominent here in Mexico. And so these groups all together are very powerful in putting pressure on politicians. And we also see in yellow the advertising and branding associations. And these really lobby for marketing freedom. They lobby against any regulation of marketing. So you can see this is really an ecosystem of lobby groups, an ecosystem of political influence that is coordinated transnationally. And so it is extremely powerful. Now, does Nestle claim to oppose breastfeeding policies? Nestle claims it does not lobby in relation to breastfeeding policies, because Nestle can make this claim because we don't think Nestle, the company itself, lobbies against the policies, the regulations. It just gives the money to the lobby groups to do the lobbying. So Nestle is saying it doesn't lobby, it doesn't oppose breastfeeding policies, but then it finances all of these lobby groups around the world who oppose breastfeeding policies. So it's a factually incorrect statement by Nestle. And this is what the lobbying looks like. This is a picture taken from the Congress in the Philippines of a lobbyist from their version of CANALEC, their infant nutrition association, speaking with congressmen about a new law that was being passed and attempting to block it. And in the Lancet Breastfeeding series, we give these case studies. We show how in the Philippines, South Africa, and the United States, how this lobbying works. In the Philippines, this lobbying targeted the president, members of Congress, officials in the health, trade, and industry sectors, the US-Philippine Embassy in Washington, D.C., and UNICEF's international and regional headquarters. So you can see when the Philippines goes to pass a law, it's not just the lobbying within the country, it's the coordination of the lobbying internationally to try and have influence and put pressure on the government of the Philippines. And some of these lobbyists met directly with the president of the Philippines to put this influence on them. We also see this very extensive lobbying in the World Trade Organization. And if you don't know about the World Trade Organization, it's the organization that regulates the international trade and investment. And essentially, what it does is it puts binding rules or regulations on how countries can regulate their markets. And that includes their markets for milk formula. And so every time a country tries to regulate milk formula, regulate the marketing of milk formula, we see these interventions, especially by the United States government, the European government, Australia and New Zealand, to block those regulations in the World Trade Organization. So they will say, the Philippines, your regulations are too trade restrictive, they are non-scientific, they exceed the standards of the Codex Alimentarius Commission. You cannot regulate your market in that way, and this is very, very powerful, and has led to many countries either weakening their regulations or stopping their regulations altogether. And we saw this in Thailand, and we present this case study of Thailand as an example of when the Thai government determines to regulate, to expand the regulation of commercial milk formula, including the regulation of toddler milks, and to have stricter penalties for violations of the regulations, that they faced multiple interventions over several years by a coalition of very powerful governments to oppose that regulation. And this was coordinated with lobbying in Thailand itself by the lobby groups, saying you were violating WTO law. And it led to a much, much weaker regulation than the government had initially intended. The narrowing, the toddler milk regulation had been removed, and the penalties had been removed as well. So essentially, this is how they weaken regulation. Now, the other way in which the companies have a lot of power, they do this lobbying, and it's very hard to detect this lobbying. We don't, it's very hard for us as members of the public to see it. But the industry, the corporations promote themselves as being socially responsible. And this is their corporate social responsibility initiatives. And these initiatives really frame the companies as part of the solution. You don't need to regulate us because we're already regulating ourselves. We're already being responsible. We're already, reformulating our products. We're developing products that are nutritious. You don't need to regulate us. We're making our supply chains more sustainable. You don't need to regulate us. And this is a very powerful political strategy as well, in blocking regulation by governments. And yet these claims ignore or distract from the really significant costs that these products generate for countries. The healthcare costs, the reductions in workforce productivity that come from not breastfeeding, and the diversion of household expenditure. Formula is very expensive. Some of these toddler milks 20, 30 times more expensive than regular milk. So that's money that's spent on formula that's not spent on something else. They also generate, these products are generating significant ecological harm, and the companies are paying, reducing their tax payments to governments as well. So they're not paying the tax to governments to compensate for these costs that they're generating within countries. So we describe this as a form of wealth extraction. And if you'd like to read more about these ideas, I'd encourage you again to read the Lancet series. The companies also have their own voluntary policies. So they say, look, you don't need to regulate us because we're being responsible. We have our own corporate policies on marketing of our products. Therefore, government regulation is unnecessary. And this is designed to delay the implementation or prevent the implementation of government regulation. And in 2016, the United Nations Special Rapporteur on the Right to Food said that we just need to be very clear that these industry policies, this self-regulation does not work. It's ineffective and it violates the rights of children. That we're not adopting law. We're not protecting their rights through law. So what do we do? What are the solutions? How do we reduce this corporate power in first food systems? First of all, we already have a lot of things that we can do and we know that are effective, and that there is consensus on. And that is we need to develop really good infant and young child feeding policies, breastfeeding policies, grounded in protecting and promoting, advancing women's and children's rights, fully implementing the International Code of Marketing International Law, ensuring coverage for products to 36 months of age, so including toddler milks, implementing the UNICEF WHO Baby-Friendly Hospitals Initiative to get formula out of hospitals, and expanding maternity protection. So maternity protection is a very important determinant or enabler of breastfeeding. So we know we can do these things. Thanks. And then of course, we can't achieve all of these policies without actually mobilizing coalitions, civil society, creating networks of NGOs, of political leaders, of government agencies, health professionals, journalists, and international agencies. And we see UNICEF time and time again in lots of countries working with governments, working with civil society groups, working with experts to really lobby for these policies. taking strategic action, parliamentary advocacy, political advocacy, finding parliamentary champions, people within Congress who can champion this cause, and conducting research to evaluate policies, to present the evidence to policymakers, and strengthening capacities. We need more money for this work. We need to fund advocacy, and we need to fund it a lot more than we currently are doing. And we need to ensure that all of this advocacy, these coalitions, are free from commercial conflicts of interest, that they do not involve anyone affiliated with the industry. We can also reduce corporate power in governance and policy decision-making. So it begins with just acknowledging that there is an irreconcilable conflict between the objectives of the baby food industry and public health objectives, that these are contrasting or conflicting objectives. Ending partnerships with industry, so no partnerships with professional associations, no partnerships with government agencies. Excluding industry from policy decision-making. Most governments now exclude the tobacco industry from policy, doing the same thing for the baby food industry and the ultra-processed food industry. Requiring disclosures of actual or potential conflicts of interest for our political, for our policymakers. Strengthening regulation of corporate lobbying and revolving doors, so teaming up with others who are calling for much stronger laws on restricting corporate lobbying of politicians and policy decision makers, and strengthening anti-corruption and bribery laws. The other thing we can do is call on our United Nations agencies to do the same thing, to end their engagement with the baby food industry, or to put rules in place or policies in place about how they engage with industry. And UNICEF has been leading the way on this. They've adopted new programming guidance on how they engage with the food and beverage industry, and they just say, we will not engage with any companies that violate the International Code of Marketing of Breast Milk Substitutes, and we will not engage in partnerships with the ultra-processed food industry. And this leadership is remarkable, and we need to see these other UN agencies adopting the same policies. And finally, I just wanted to say that ending health professional capture and conflicts of interest is absolutely essential. Ending financial relationships, partnerships, product donations and sponsorships. Establishing clear codes of conduct and disclosure rules for those involved in professional associations. Making sure that those people who are affiliated with Nestle are not on the governing boards or the committees of professional associations, and promoting publicly funded and independent research that has no conflicts of interest, and using research that is free from conflicts of interest to guide clinical and health professional decision making. And finally, we can strengthen health professional education on conflicts of interest, on commercial influence, and how to manage it. And I think, if there's students in the room today, the answer is also very obvious. If you're approached by a formula company, just say no. I do not want contact. And if you see others who are engaging with the formula industry or companies, put pressure on them. Say no. If you see your professional associations being sponsored by baby formula companies, say no. That's not acceptable. It's unethical, and we do not want it, because you are the leaders of tomorrow, and your voices are very important. And thank you very much. That concludes my presentation. Thank you.
Muchas gracias, Phillip, por la interesante presentación. Realmente grato ver cómo el primer sistema alimentario ahorita está presente en estos temas de discusión. En el 2022, con la discusión para las la cumbre de sistemas alimentarios era un tema prácticamente ausente. Nosotros en los diálogos nacionales tratamos de incluir el tema, pero realmente ha estado ausente el primer sistema alimentario dentro de estas discusiones. Entonces, un gusto que estemos levantando el tema y meterlo en la agenda política de los países